Welcome to Nursing 575 Psychopharmacology. I'm Ricardo Broach, and along with Julie Worley, I'm going to be one of the instructors for this course. We're really looking forward to being with you, and I've put together this about 7-minute video. It's the first time I've ever done anything like this, so I'm having some real fun trying to get this technology done. But what I want to do is give you an overview of the course. First off, we know there's an awful lot of material that you're going to have to be learning in a very short amount of time. And it's going to feel like there's just stuff coming at you all the time. I'd like to offer you two images as we begin to help you deal with all of this. The first is, if you could picture your brain like a warehouse, and over the next 16 weeks, there is so much material that we are going to be having you put into that head of yours. It's going to feel like forklifts are coming in there all the time, just shoving stuff in and shoving stuff in. We know it feels overwhelming at times. But another image that might be helpful for you is to think of the psychopharmacology as an artwork. And if you watch an artist, the first thing an artist does is to paint very broad outline structures of what they're going to be doing, and then they go in and they start putting in more detail, and then they start putting in the shading and the contrasts. That's my image of psychopharmacology, at least for myself, that it's a lifelong learning process. So over the next 15, 16 weeks, what we're going to be doing is giving you some very basic broad strokes. You're going to learn the primary medication classes used to treat mental illness. You'll be learning the mechanisms by which they act. You'll be learning some of the side effects and drug interactions that can take place with these medications. And then if the medications require some type of monitoring, lab studies, vitals, that also will be topic of conversation. So that by the time you finish, you will have a fairly good basic understanding of psychopharmacology. Now let's talk about the course itself. I did put together the syllabus, and it's fairly long, and so another thing I did was I put together this grid that you can see. In one line, it has everything that you have to do and by when. So I hope that this will be a useful tool for you. We've also divided the course into pretty much two-week segments. And in the first week, we will be having discussion of our content from the stall texts, which we'll talk about in just a minute. And in the second week, you'll have case studies and discussion around the case studies. Now, we really hope that these discussions will be interactive and conversational. We don't want them to be just reports. So when you place a post, we ask you to also try and stimulate conversation, ask questions. When you reply to someone, also try and pose questions. Now, let's talk about our textbooks. The first textbook is this big course called Stahl Psychopharmacology, or Essential Psychopharmacology, Neuroscientific Basis. And then the companion book is this, The Prescriber's Guide, also by Stahl. Now, I use this textbook for myself, and it's an excellent textbook, but I gotta tell you, this is the one I keep on my desk, and I use it every day in my clinical practice. It has every medication, very good information, well organized, very simple to understand, and is also in here that you'll find that information you need about what type of lab studies need to be done with medications, what type of monitoring needs to be done. So let's look at this big textbook here for just a minute. We know it is a huge textbook and can be rather daunting to look at. But I want to draw your attention to the fact that in the textbook there are both graphics with captions, and there's then text. Now if you'll think about it, there are a couple ways you can read this book. You can read it from cover to cover and from top to bottom, or you could go through and you could focus just on the graphics with the caption underneath. That would be another way, because the graphics and captions are very complete in their coverage of the material. Or you could read the text and try not to get too distracted by all the graphics and captions. All depends upon which way you like to learn. Now, We also know that these readings are very long, and so what we're going to be doing is having you do a small group discussion, and each of you will be assigned some questions to delve into the text and to express it in your own words and encourage conversation and learning in your colleagues. And then all of these discussions are time framed because we do want to keep us moving along. So we ask that you respect the time limits that are given in that grid and schedule. The case studies then in the second week are our way to bring it all together. And in those case studies, we also expect you to be actually writing out the scripts that you would give to the clients. We don't want you to say something like, well, I would prescribe an SSRI. What we want you to do is to say, I'm going to prescribe sertraline, 50 milligrams, dispense 30 pills, take one once a day, one refill, that type of thing. And then if there are lab studies, we need you to specify which lab studies you would have done. Another part of the learning process for you to help you integrate all this material will be quizzes at the end of each 2-week segment. But the quizzes are not for credit. They are a way to help you integrate the material and to prepare you for the midterm and the final exam. The midterm will cover the material from the beginning of the course to the middle, and then the final will be from the midterm on. It will not be cumulative from the beginning. It will be the midterm and on. And those will hopefully prepare you for this wonderful thing called the American Nurses Credentialing Center exam that you take after you graduate. You do need to know that the ANCC exam, while it focuses some questions on medications, it is not specifically and only about medications, because we as psychiatric mental health nurse practitioners have a much broader perspective of mental health. However, this course is going to concentrate primarily on psychopharmacology, and we are very much looking forward to learning with you.